What recent reports has he seen about MedSafe?
Mr. Speaker.
Honourable David Seymour.
Mr. Speaker, really impressive news from MedSafe's annual performance statistics for the 24-25 year. It shows that it is approving new medicines for New Zealanders faster than the year before, which in turn was actually faster than the year before that. I'd like to especially thank Chris James and his team. I think that they're working fantastically well to get more medicines for New Zealanders. They also, again, met 100% of their targeted timeframes for approving new over-the-counter medicines. I think it's a very good example of how government can work to ensure that New Zealanders have access to the medicines they need as quick, ideally quicker, than citizens of other countries.
Supplementary. How many working days has MedSafe reduced approval times over the last 2 years, and how does this compare with international benchmarks?
Well, Mr. Speaker, over the last 2 years, MedSafe has cut over 100 working days from assessment time. So they're doing it about 5 months faster for a new medicine than they were 2 years ago. On innovative medicines, 59 days faster this year than last. And that year itself was 55 days faster than the previous year. For generic medicines, 64 days faster this year than last year. That was after a 45-day improvement the year before. So this scale of improvement is really putting New Zealand amongst other performers around the world. We're firmly in line with the likes of comparable jurisdictions like Australia, Canada and Singapore. And for the member who has just sprung into life, although perhaps not mentally,
That's it.
I can tell you the answer.
That's the end of the question. The member will sit down. Well, you might call a supplementary. I just said it's the end of the question. We're not going to go down those tracks. So ask your supplementary, but I hope the answer is appropriate. Todd Stevenson.
How will the rule of two change the experience for patients waiting on new treatments compared to the current system?
Well, Mr. Speaker, some people could think that Chris James and his team at MedSafe could be complacent, having got us competitive with the rest of the world, shaved 100 days or 5 months off the time, 100 working days or 5 months off the time to consent to new medicine just in the last 2 years. But we are far from complacent, Mr. Speaker. This government is bringing legislation through Parliament that will introduce the rule of two. Early next year, the rule will be that if a medicine is allowed by 2 other similar jurisdictions, the likes of Australia or Canada or the United States or the European Union or UK or Japan, for examples, if those are allowed, if those countries have allowed something, if 2 of them have, then within 30 days, they'll be allowed here in New Zealand. That is going to be another exceptional improvement. And
Sorry,
I have to say...
Stop. Sit down. That was a very unnecessary interjection. And I'll ask the member to withdraw and apologise to the House for that language.
I withdraw and apologise. Point of order, Mr. Speaker.
Point of order.
Does he need to withdraw and apologise for attacking another member's mental health?
He didn't get to that. I stopped him before he did it. Finish the answer, and that'll be the end of the question.
Mr. Speaker, I'd also like to answer what I anticipate could have been the third supplementary question by saying that in case someone was to ask for an example of a medicine that's been assessed faster, Omjara, a blood cancer medicine, that was approved 131 days faster than the average time last year for innovative medicine. So these are new medicines that make a real difference in people's lives, and I think we should all be really proud of what this particular part of the government is achieving for New Zealanders.